Extavia Kit is a medication used to treat multiple sclerosis, MS. It is not a cure for MS, but it may help to slow disease worsening and decrease flare-ups of symptoms, such as balance problems, numbness, or weakness. The daily dosage and the optimal timing for taking this medication will depend on your specific condition, so it's important to follow your doctor's instructions carefully. Before using Extavia Kit, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Inject this medication under the skin as directed by your doctor, usually every other day. It is best to use this medication near bedtime to reduce side effects. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. Do not inject into skin that is red, sore, scarred, or infected. Inject this medication under the skin in the thigh, abdomen, buttock, or the back of the upper arm as directed by your doctor, usually every other day. Tell your doctor of any skin reactions that do not go away after a few days. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time for each scheduled dose. Tell your doctor if your condition gets worse. Some common side effects of Extavia Kit include injection site reactions, abdominal pain, constipation, diarrhea, upset stomach, and nausea. Many people also experience flu-like symptoms such as headache, tiredness, fever, chills, and muscle aches when they first start this medication. These symptoms usually last about 1 day after the injection and improve or go away after a few months of continued use. You can lessen these side effects by injecting this medicine at bedtime and by using fever reducers/pain relievers such as acetaminophen or ibuprofen before each dose. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, tell your doctor right away if you experience any serious side effects, such as mental/mood changes, changes in body temperature, joint pain/swelling, or signs of kidney or liver problems. Extavia Kit may also lower your ability to fight infections, so be aware of any signs of infections and seek medical attention if necessary. Additionally, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you experience any other effects not listed here, contact your doctor or pharmacist. Before starting Extavia Kit, make sure to inform your doctor or pharmacist if you have any allergies to interferon or human albumin, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your healthcare professional about your medical history, especially if you have any bleeding or blood problems, heart issues, liver disease, mental or mood disorders, seizure disorder, or thyroid disease. It's important to note that interferon may increase your risk of getting infections or make current infections worse. Try to avoid contact with anyone who has a contagious infection, and talk to your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, let your healthcare professional know that you are using interferon. Avoid contact with people who have recently received live vaccines. If you are planning to have surgery, inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. If you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with Extavia Kit, as they can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first getting approval from your doctor. This will help ensure the safe and effective use of Extavia Kit. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or reaching out to a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share your Extavia Kit with others. Your doctor may also want to monitor your blood count, liver, and thyroid function while you're using this medication, so make sure to keep all your medical and lab appointments. If you forget to take a dose of Extavia Kit, take it as soon as you remember. Then, talk to your doctor or pharmacist to figure out when to take the next dose. Your next injection should be about 48 hours, 2 days, after the missed dose. Do not use this medication 2 days in a row, and do not take a double dose to make up for the missed one. Always follow your doctor's instructions for dosing. When storing the unmixed Extavia Kit, make sure to keep it at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom and to keep it out of reach of children and pets. If you mix the solution and don't use it right away, you can refrigerate it and use it within 3 hours. Do not freeze the solution and make sure to discard any unused portion after 3 hours. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.